know that anti-VEGF agents are the mainstay of treatment in DME, and for FFA and OCTA help to visualize the retinal microvasculature. So the primary objective was to assess the retinal vascular area, the phase area, and the number of microaneurysms at both SCP and DCP before and after intravitreal anti-VEGF injections. So it was a retroprospective longitudinal study conducting at a tertiary eye care institute, which included 77 patients. Patients having a central macular thickness of more than 300 microns who received at least 2 anti-VEGF injections having a follow-up of 6 months but with good quality images were included in the study. So EMR was assessed for the demographics, the visual acuity and the OCT images. Anti-VEGF injections were given monthly for 3 months followed by a PRN regimen. Retreatment was indicated if CMT increased to more than 300 microns, or if there was exudation, or if there was a drop in vision. PRP was done wherever indicated. OCTA was done using the Heidelberg Spectralis machine, including a central 30-degree 6 into 6 mm scan. Automated segmentation was done into superficial, deep capillary plexus, outer retina and choroid. The image analysis was done using ImageJ software. All the images were transported into the software, converted into the 8-bit image. Then with the manual hand selection tool, the area was delineated. With the analysis tool, a scale was set of pixels per mm and the area was measured. So in this way, the phase area was calculated to be in this image as at DCP as 0.178 pixels per mm square. Similarly, microaneurysms, the image on the right is the image of the deep superficial capillary plexus, whereas on the right is of the deep capillary plexus, which shows the microaneurysms as saccular dilatations marked with red circles. This is the OCT image showing the retinal avascular area, which was done after converting the image into the binary form. So total 71 eyes with good quality images were taken. There was a mean change in mean number of microaneurysms decreased significantly both at SCP and DCP. The phase area also decreased in SCP and DCP at 6 months. At 6 months, the retinal avascular area decreased significantly at both the SCP and the DCP levels. And it was also correlated with the mean visual acuity, which improved significantly at 6 months, which was my secondary objective. So previously, Soror et al. Had showed that vascular density remained statistically unchanged. However, in my study, the avascular area decreased both at DCP and SCP, and we found a weak positive correlation with BCVA. Similarly, Elnari et al. In their study showed that there was a significant increase in the phase area. However, in my study, the mean phase area decreased, suggesting improvement in the macular perfusion. Bromeo et al. In their study also showed that phase area remained statistically unchanged, which was contrary to this. Our study showed that it decreased. Meleka et al. Shows that microaneurysms were seen better at the deep capillary plexus level, which was a similar result in our study. The limitations of my study majorly was the segmentation error. However, we tried as much as possible to manually improve the segmentation. And mean area may not detect focal areas, and phase area may vary even in normal individuals. So the conclusion, this was a study done to see the OCTA characteristics on the Heidelberg machine in Indian eyes after the removal of projection artifacts and manual segmentation, and retinal perfusion and phase area both improved, correlating with the improvement in visual acuity. Thank you.
Judges, questions?
So how do you explain the improvement of your foveal vasculature?
Because with injection, the ischemia decreased. So like the improvement in the retinal perfusion, which was like majorly seen at the macula, with subsequent injection, the retinal perfusion increased, which was reflected at the macula.
You have not mentioned what drug the patients have received?
Ma'am, they received 3 types of injections: ranibizumab, bevacizumab and aflibercept.
So did you see any difference across these 3 drugs?
Ma'am, due to the large sample size and the study time was very limited, because I had to submit it to the DNB, so I did not study the inter-drug, the cross-sectional.
So if the patients have maintained on the same drug throughout, it shouldn't have been a very difficult statistical analysis to do.
Ma'am, it was like if subsequently after 3 injections, some patients changed the drug in the PRN regimen. So I followed them only till 3 injections.
So if they have not changed it in the 3 injections and you have followed the patients, you could have analyzed the difference between the drug.
Yes.
Yeah, and though there is a reduction in macular edema, which of course you have not even mentioned the OCT findings, you have only mentioned the OCTA findings. OCT findings should also be there along with it for completion of data and for proper correlation. but there isn't any evidence of anti-VEGFs improving perfusion. So how do you explain your improved FAZ area?
Ma'am,
Yeah.
it could be because the foveal avascular zone was distorted before the injections, and as the macular edema improved, like the cysts when they dissolved, it became more compact.
Exactly.
And it could be the
yes. So that is your reason, that because when there is an edema, the vessels get pulled apart, and that is a known artifact in OCTA, that it causes a false enlargement of FAZ when you have edema. And when the edema reduces, they come back. So that may not be really an improvement, but it's the improvement in the edema which is giving you a false finding of improved reduction or improved perfusion in the FAZ.
What was your total sample size that you have not mentioned?
77 eyes, ma'am.
71. And have you included the patients from both the types of diabetes, insulin dependent? That also you have not separately mentioned. And whether the duration of the diabetes, diabetic retinopathy or duration of diabetes, that is also not mentioned. And what was your exclusion criteria?
Ma'am, patients, exclusion criteria, patients which had other ocular
That is also not mentioned. And as ma'am has rightly said, the number of cases you have allotted to each group, that should have been tabulated properly. That is again not included.
I will make these changes again. If I send this for publication, I will consider your comments.
The time period also.